Good afternoon, friends. We welcome you all in Thursday meeting, which is continued for several decades. During the rainy season, we see that less attendance here in this on the offline center, but still there are the interest and many viewers have joined our program. For this session, we are going to have a beautiful subject on the very demanding subject, very required understanding about the diabetes. Diabetes, which has become the way of the life for most of people. It is a lifestyle problem. It has taken away the peace of our mind, and the peace of the mind, the taste of our life. And what we would require, the basic things that everything should be sweet, everything should be normal, as polite and as mild as it is, and that is called the sweetness of the life. And what I feel that it is not because of the diet, it is not because of the your what the way you are living. It is only because of the imbalance that has been created in your life. So today we are going to discuss on the imbalance of sweetness in the life through the diabetes. What it is and why it is important to maintain the sweetness of the life. It is not that diabetes is a disease where the sugar is increased, but the disease where the sugar balance has been destroyed, has been distorted, has been. So now I'm going to share my PPT so that we can have some views on it. So diabetes, the imbalance of sweetness in the life. And now we are going to study through the homeopathic approach. Uh, the sweetness of the life lies in its beauty. How much useful you are, how much useful you are to the society. This is very important. And life is there. Life is not to live. It is only to serve. The purpose of the life, you have been born not to gain something. You have to gain. You have to give something. So giving and taking, these are the two aspects of the life. And life is said that it is a well-lived life is that how much you have contributed to the development of the society, development of the society and the development of the country everywhere. So this is very important things that we have to understand. Like so, sweetness of the life lies in the usefulness, like honey deep in the heart of a bloom. And what is the diabetes? Which I say that it is the thief or it is the robber of the sweetness from your life. It is a metabolic disorder in which a person cannot metabolize sugar in the body. So metabolism is the basic factors for your life to maintain the life itself. As the level of blood sugar knows, as glucose rises, especially over the long period of years, the sugar becomes toxic to a number of systems of the body, including the cardiovascular system. And diabetes, it is the fear of fully participating in life. Now, what you have to do, what you do, you have start having, why you get the negative emotions in your life? Only because you are not able to sustain and cope up with the changing environment. So there is a great need for the control to know the things, need need for attention and approval, and constant craving for the love, with the belief that you are unworthy or undeserving. So we who don't want the love? Everyone wants the love, and everywhere the love Where love prevails, the, the mind and the mildness and the society remains very calm and quiet. So deep-seated guilt, so many beliefs, so many thoughts, so many guilt feelings are there. So struggle to survive is the important thing, and this struggling brings a loss of the relationship, loss in the relationship. So constant need for the sweetness to mask the feeling of the weakness, limitations, and belief that there is not enough. But we satisfied with our life? No. Most of the time we feel that something is missing, something, and we want to earn more and more, more. Why it is like that? Because the mind is embedded in the earthly, in the materialism, and where the materialism there is the vastness of the attractions and the society things, the comparison, jealousy. These are the common features for the present life which we see. And when there is a jealousy, when there is a fear, when there is a life, where is the peace and where is the sweetness? The sweetness is lost. So glucose need to be a certain level for the brain to function normally. And I say not it is glucose, the sweetness is required, your peace of the mind is required for the normal functionings of your brain. After we eat, sugar level normally rise to the body, triggering a release of a hormone called insulin from cells in the pancreas called beta cells. Insulin knows how to open the door of all the cells in the body, allowing glucose to enter them. As glucose enters the cell, sugar level drops off until we eat again. So this is the balance. This is the everything is about the balance. The balancing element are the insulin, and this insulin opens the door and closes the door for the maintenance of the. So you eat throw it out from the body. If there is a balance, you will feel happy, you will feel healthy. But if you eat more and you are unable to utilize them, it becomes a dirt for your life. And if you have the requirement and if you don't eat, it also becomes a dirt for your life. The cell of our body needs glucose to produce energy, and the only brain's only food is the glucose. When we eat, the pancreas automatically produces the right amount of insulin to move glucose from blood into the cells. In people with diabetes, the pancreas either produces little or no insulin. This is the imbalance. Or the cells do not respond appropriately to the insulin that is produced. And this glucose, this is the hindrance that is created. Hindrance. And that makes you either the overflow or either the underflow of the in the blood. So it is in the urine, it passes in the urine or in the blood, it is observed like that. Thus the body loses its main source of fuel even through the even though the blood contains large amount of the blood. And the content of the blood is also glucose. But when it gets increased, you say you are suffering from the diabetes. And how many type of the diabetes are there? There are the two type of the diabetes, the type 1 diabetes and type 2 diabetes. Type 1 diabetes is immune disease. Becomes self enemy of all the cells. I say the autoimmune disease means the enemy of the cell's life, own life. You become enemy of your own life. And autoimmune disease results when the body system for fighting infections, the immune system turn against a part of the body. In diabetes, the immune system attack and destroy the insulin producing beta cells. Little or no insulin, a person who has type 1 diabetes must take insulin daily to live. And type 2 diabetes, the most common form of the type 2 diabetes, because it is the lifestyle related. So 90 to 95% of the people with diabetes having type 2, This form of diabetes is most often associated with older age, obesity, family history of diabetes, previous history of gastrointestinal diabetes, physical inactivity, and certain ethnicity, that is the lifestyle. Predisposing factors for the type 1 diabetes is genetic factors are the basic. You will find lot of the genetic problems in the family. Strong concurrence of type 1 diabetes in monozygotic twins suggests a major role of the genetic. You will see the juvenile diabetes among this category. The major histocompatibility complex antigens are thought to be the important. Most type 1, so either DR2, DR3 or DR4, while DR2 is thought to be the protective against the diabetes. And predisposing factors for the diabetes is auto antibodies in the in type 1 diabetes. Isolate cells auto antibody are present at diagnosis but will gradually decline and disappear in swing years. This means that there is diagnostic uncertainty. Isolate cells antibodies can be checked early during the presentation. And in the diabetic type 2 diabetes, uh, increasing prevalence of obesity, more children are now presenting with the type 2 diabetes. Latent autoimmune diabetes in adult is thought to be compromised about 5% of all the patients with the type 2 diabetes. And this is also known as the monogenic diabetes. Is the term used for the collection of conditions that causes diabetes now show a result from a single gene defects. One feature of these conditions is that they show autosomal dominant inheritance pattern where the disease appears to be vertically transmitted. It is now becoming more convinced that there is an intimate and dynamic relationship between what is going on with our feeling and thoughts and what happens to the body. So mind and body relationship. This is very important. What is there in the mind and how the body is responding, or what is the requirement of the body and what is the inability of the mind. If you don't have the balance, this type of the balance, this is called this may be the basic cause for that. Now it is becoming convinced. The people are not associating with the eating more sugar or less sugar, because there are many places in the country where you will find the people are habituated to take lot of the sweets. Not like in the North India, if you go in the Bengal, they are the sweet consuming society, and you don't find the diabetes there. Less number of the diabetes are reported among the North Indians or among the Bengali nowadays, because of it is increasing there also. Mind effects on organ related to the diabetic changes in the body. Now, homeopathic approach for the diabetes. According to the homeopathic guidelines, the patient is to be treated not his organ or parts or the system of the tissue. In diabetes mellitus, our objective of treatment the patient himself, not the pancreas nor the B cells. So the constitutional treatment is the only way for a radical cure of diabetic mellitus. Along with a proper diet control and regular exercise, our aim is not merely to bring down the blood sugar level, but also improvement of the both subjective and objective aspect of the life. So this sentence truly applies to patient of diabetes. If now this is very Hippocratic statement. If someone wishes for good health, one must first ask oneself if he is ready to do away with the reason for his illness. Only this then it is possible to help him. How you can help a patient if he is willing to take the help. If the person is not willing to take your suggestions, if the patient is not following your counseling, your restrictions or your instructions, then you are not going to help. The medicines will not work alone. This is beautiful line from Hippocrates. According to Dr. Henneman, there cannot be, strictly speaking, any local disease of the living organism. The organism is a living individual whole which act and react as a whole. Any disturbance in the nature of dynamic changes is never confined to a specific part of the organism, in the sense that the rest of the body does not participate in the dynamic changes produced by any means. And emotions plays a great role in managing the diabetes. The concept of love is certainly central to understanding the managing diabetes. The role of emotional factor in the etiology of diabetes has been a source of debate. However, personality traits of diabetic patients have been studied, and many researchers have noted similarities of the configuration. So emotional balance. Emotions is the basic, I say the uh, aspect for managing your mind, your thoughts, everything has to be managed. And this managing factors, if it is disturbed, if you are, there are two types of the emotions are there, positive emotions and negative emotions. When there is an imbalance between the positive emotions and the negative emotions, or emotions becoming negative, or emotions becoming positive, there is a balance. This balance in the mental sphere. And when mind is not in a proper condition, in proper functioning, it is not able to control the body also. So character. Personality character is linked with the symbolic language of pancreas. The pancreas is linked to the solar plexus that deals with the emotions, wishes, and intellectual activity. It has been realized now that pancreas is the street for the emotions. Diabetes are found to be more emotional and harbor many wishes for themselves and others. They tend to reproach themselves with discontentment of others. They spend much energy fulfilling the inner needs of their emotions, and there is associated inner sadness from the unrequited love. The pancreas represents the sweetness of the life. And juvenile diabetes. Nowadays, you see most of the children are suffering from the diabetes. It is known as the juvenile diabetes, or those children who feel insufficiently acknowledged. In short, the problem of the pancreas stems from individuals not believing that they deserve the love. Now, there is a jealousy among the children. In a family, one child is loved more, another child. So there is a disparity. And this disparity has caused many of the children to suffer from the diabetes, and this is recognized now, and gradually it is increasing. This disparity, everywhere you see, the reason for having the diabetes is the disparity, or the disbalance, or the imbalance in the life. There is a huge inability of field to feel part of the whole and give the receipt balance. And probable mental causes for the, now, what are the mental causes for longing for what might have been? I want this, I want that. And if you don't get, there is a need to control the deep sorrow. No sweetness is left. Pancreatitis, rejections, and anger and frustration, because life seems to have lost its sweetness. Mental attitude, refusing to give, take it from deliberately withholding self. So this avarice nature, greed, they are responsible, and fear of never being able to have enough, more and more. See, there are the rubric like uh, uh, bulimia, the bulimia nature, the bulimia. What they're not satisfied with the what they are eating. This habit is being observed, not satisfied with what you have in the present. So when dissatisfaction with the present condition, so desire to give and hold back, on this fear of losing from giving, an attitude of self-righteousness with selfishness, conditionally giving and receiving is the jealousy. So constitutional anti-miasmatic treatment, along with the due stress on preventive measures, plays a significant role in radical cure of patients suffering from diabetes, and also preventing long-term complications. Now, the miasmatic background of the diabetes, the SORA, where secondary cause, especially the psychological stress, are the main responsible factor causing functional disturbance in the disease pathogenesis in type 2 diabetes. And soda is the dominating factor in the behind the disease process. Psychosis in the pathogenesis of type 2 diabetes, insulin resistance, inability to the peripheral tissue to respond to insulin and abnormality of glucose receptor and weak cells of pancreas are the primary cause for rather than inadequacy of the insulin. So the incoordination is the sole factor in the disease process. Therefore, psychotic mind should be present here. And syphilis in the pathogenesis of type 1 diabetes, where destruction of the B cells uh, is the sole cause of the disease, syphilitic margin should be present in this country. So you see the functional, you see the approach, the functional disorder, the disorder at the peripheral interest, and lastly the destructions level at the syphilis. So Dr. Henneman has stated in the chronic disease that diabetes is the soric manifestation. As per the above knowledge of different pathogenesis, we can consider this statement as the prime truth, and on the field of the basic SORA, other minds, psychosis and syphilis can build up their own manifestations accordingly. And according to the many stalwart, diabetes belong to the mixed mind state of the SORA and syphilis. The seven factors uh, and homeopathic remedy: genetic factors or of B cells, beta cells function or insulin action, developing include DNA, nosodes, carcinosin, medorinum, tuberculinum, and cefrinum. Diabetic mellitus resulting from disease of ectocrine pancreas, arsenic L, Barita mu, calcaria, carbo anomalies, carbo veg, and so many medicines are there. And diabetic resulting from endocrinopathy, the Barita carcinosinum, pituitarium, and so many medicines are there. So you see the list and you can understand that how far it is we can apply these medicines. Simply knowing these medicines is not enough, because knowing the totality of the patient is very much important to understand the diabetes for the treatment of the diabetes. Then drug-induced medicines, drug-induced diabetes. Nowadays it is very common. People are taking medicines for the hypertension, people are taking medicines for the thyroid, and gradually they get converted into the diabetes. So agaricus, agnus cast, and arsenical, bryonia, camphor, puja, thyroidinum are important. Then infections, carcinosin, medorinum, tuberculinum, staphylinum, all nosodes are very important, including the silicea. And gastrointestinal diabetes, lactum, lac acidum, and helonius and sulfur. And immune mediated diabetes are DNA, nosodes, carcinosin. DNA is the medicines. In homeopathy, we have developed medicines DNA, carcinosin, medorinum, tuberculinum, and cefrinum. So, how the therapeutic index of the remedy can be evolved. Repertoire symptoms related to the diabetes, clinical rubrics, diabetes common symptoms, universal complications of diabetes, the role of love in the diabetes. The study of repertoire filter, focusing on the polychrist remedy and evaluating the remedy data through materia medica and clinical experience. Developing the therapeutic index in order to their importance in clinical practice and not necessarily on quantity of mark. The filter being used as an entry point for the more. So, on the whole, we can understand that the role of the repertory, role of the symptoms totality, and the role of the mental symptoms is very much important in finding out the proper medicines for the diabetes. Now, in the repertory, you will find 92 medicines under the diabetic insipidus, and there are uh, 195 in the diabetic mellitus. 195 medicines are listed there. Then in the urine chapter, you will find sugar, and there are 149 medicines are listed there. So therapeutic things we can have some understanding. Cordanium, where there is excessive skin irritation, itching due to the diabetes medicine. So this medicine has been noted therapeutically. Then phosphoric acid, when diabetic mellitus start after some nervous exhaustion, working too hard or disappointed in relationship. Remedies like gunpowder, staphylococcus, and melaleuca and alternifolia are extremely useful for diabetic carbuncle and gangrene. And then remedy like urea pura, amyloposis folia are extremely useful in diabetic neuropathy. Diabetic neuropathy is another important area. The peripheral neuropathy is common complication of diabetes and may appear at the first manifestations of the disease. It is likely to occur in even the mildest case of the diabetes. So antiseptic medicines are important here. Aurum, zinc, phosphate, calcium, magnesium, cuprum, strontium, plumbum, etc. Ashwagandha, mother tincture can be tried for the neuropathy. A case of diabetic neuropathy where the patient was unable to sleep due to the pain, tingling, and numbness of legs was helped with the zinc sulfate. One more case where burning of the soul was the prominent symptoms got benefited with the Medorina. So diabetes mellitus is an important cause for end-stage renal failure. Now this is another area, neuropathy relative to the renal failure. In one case, Cuprum arts responding quickly, he was restored to consciousness, started passing urine, and at least for a few months, the dialysis was not needed. Then another important area of the diabetic is the retinopathy, getting blind. Is the result of microvascular retinal changes, hyperglycemia-induced intramural pericyte death, and thickening of the basement membrane lead to the incompleteness of the vascular wall. These damages changes the formation of the blood-retinal barrier and also mark the retinal blood vessels and become more permeable. So carbon naphthalene are often indicated in this condition. So now I am going to give you one case, a lady of the 61 years. We started treating her in 2018, and it was the weakness was the general. Weakness was in general muscular pain all over the body, tearing pain in the legs, numbness and tingling in the legs while walking and sitting, coldness of extremities, and frequent urinations with the blood vision. This was the case presentation. Then associated complaints were pain in the joints, especially in the knee, and sleeplessness after breakfast, desire to remain in bed all the time. This is very important to mind. They don't want to move, and frequent vomiting with indigestion. And past history of the family was the cyst in the knee. Her past history, there was a cyst in the knee which was operated in 1997. Polypus in uterus. Father died, had suffered from the depression. Mother was diabetic. She is one brother and two sisters. Married at the age of 24. Husband, a retired government official, and he is diabetic. And one son and two daughters. Mental, physical, she is a retired teacher. Liked working to remain busy, loves discontented with the life situation, easily affected by contradictions. God, like gardening was a chore. She was always in hurry and she was very fond of eating. Too much eating. We usually call them to the voluminous type of the person. And desire sweets and aversion for the meat. And fasting aggravates. He can't tolerate the fast and flatulence after eating. The case was reported like this: general diabetes, then neurological complaints accompanied. This contains one medicines and occupation thyroid, sensory, she was very critical lady, elements from contradictions, discontented, diabetes associated, and numbness in the feet, hitting aggravate. You see the helonius. Can you think about the helonius in this condition? Because this single rubrics, single medicine rubrics is the neurological complaints associated with the diabetes. And this Hellenius was selected not only because of this rubric alone, but because of the support of the 7 rubrics that was supporting the Hellenius body. Now, if you go into the Hellenius, predominantly affect the female genitalia. This is the history of the sadness aggravates on seeing others happy with aversion to company. Amulets when keep busy occupations of mind doing something restless, irritability from contradictions and fault finding. Aggravation, thinking, complaints, aggravate. These are the main rubrics that were medicine. So we transmitted that case with the Hellenius diaphragm in 0/1 potency. On 5th of the March, it was reported that numbness was much better. Reported on 23rd of April in 2018, insulin intake reduced to 10 units only, feeling energetic and numbness tingling is no more. So treatment is still continued and the patient is having less problem at this stage. So with this cases and one useful information to prevent diabetes, reduce sedentary, keep on working and physical exercise, care of the gum cells, control diabetes, lack of or too much sleep raises diabetic risk, and then breastfeeding reduces mother diabetic risk. Nowadays mother are not they feel shy in feeding their mother, feeding their children. So for them, there is a risk of the diabetes. Mother stress triggers the diabetes in the kids. Reduce waistline, lower diabetes and heart risk. A spinal cord shrinks in diabetes neuropathy. Hepatitis C linked to the diabetes, type 2 diabetes, and psychotherapy helps control diabetes. Laughter cuts the blood sugar level. So the treatment for the diabetes mellitus in homeopathy is extremely effective, but people do not come to us in early stage, and hence once the pathology is advanced, we cannot cure but only palliate the condition. It is the sweetness to let the mind unbended on occasion, and so we have to be positive. This is very important things for uh, getting prevented from the diabetes. If you don't want to have the diabetes, just become a positive factor, because life, the ultimate of the life is the death. It is known to all of us, but the positiveness part of the life is very important for us. So freedom is the state of the mind. So freedom is the state of the, and when you have the freedom of the mind, you don't feel that. So thank you so much for your presence here, and I hope you give. I try to give you some the feedback on the homeopathic point of view, but because as a homeopathic practitioner, the understanding the mind, understanding the totality of the symptoms is, and you don't have to fear from the diabetes. The word diabetes are misleading for the practice of homeopathy. So don't get scared with the diabetes that it is incurable or curable. It is not the matter. It is the matter that how much relief that you can give to the patient. So thank you very much. And with this, I close down this PPT, and I hope I may be able to give you some guidelines for the diabetes. It is not only that diabetes system that I have taken this topic. It is only all the lifestyle disorders, including the blood pressure, including the kidney disease, the cyst in the kidney, the blood urea, autoimmune disease. All these diseases require the similar type of the understanding. So thank you, friends. There are some listeners here. Questions may be there, but I don't see any questions on my question box. Uh, so I close this session now, and we hope that we'll meet again on the next Thursday. So thank you very much.